Hi everyone, my name is Lulu Ndapatani. I am a cohort member for the inaugural thematic journey on family planning and contraceptive access, class of March 2024. I currently work at ICAP at Columbia University in a project to eliminate vertical transmission of HIV infection. My project is on improving contraceptive access amongst the Binti Shujaa receiving peer-to-peer support in Nairobi County, and today I'll just very briefly be walking you through what I managed to achieve during this time. The Binti Shujaa is a peer-led psychosocial education and empowerment initiative. Its main purpose is to support young pregnant and breastfeeding girls to navigate the maternal, child and reproductive health space for ANC care, labor and delivery during the postnatal period, and ultimately take up a contraceptive method in future so that they can be able to avoid unintended pregnancies. I am deeply committed to creating meaningful change. I usually stay fully engaged in any project or any initiative that I feel very strongly about. I'm passionate about nurturing growth in others and ultimately also empowering individuals so that they can be able to thrive. The statement of my problem is I started with the collecting baseline project, baseline data earlier this year. Sorry, that then would be early last year, that's 2024. And the baseline data really showed me that 50% of the breastfeeding and non-breastfeeding women who are attending Binti Shujaa services are not on a modern contraceptive. And we know that the lack of access to contraception and family planning is a limitation by itself because it may lead to subsequent unintended pregnancies. There's limited opportunities to complete education because the young girls are dropped out either in primary or mid-high school. We know that without a high school certificate or a college certificate, then there's reduced chances of employment. And of course, there's increased vulnerability to HIV infection and increased vulnerability to gender-based violence. So with the baseline assessment findings, one of the barriers that I got during that feedback is that there's a lot of myths and misconceptions amongst the young people in regards to contraceptives and family planning and what they can do to you and what they cannot do to you. And then there was also lack of simplified contraceptive information that, young people at that age would be able to read, understand, and even possibly take action to prevent future pregnancies. So with this, I designed interventions to respond to the baseline results, and I also designed a training package which had very simplified information, infographics, photos, to just explain how each of the contraceptives work and where they would be able to get those contraceptives. And with this, I also added a bit of information about HIV prevention because we know that the young people are sexually active, and the same way you would get pregnant is also the same way your risk is increased for HIV infection and other sexually transmitted diseases. So with that training package developed, I trained starting with 85 Bintis. These are the young women on family planning at uptake, and also included a bit of the myths and misconception and how to clarify this should they come across those situations. And then I also trained 30 caregivers and guardians because sometimes guardians and caregivers can be a hindrance to access of a lot of sexual reproductive health services for our young people. So some of the outcomes I managed to realize during the project implementation is after training 85 girls, the 85 girls then cascaded the information that we had given to another 164 girls. Out of the 164 girls, 124 were referred for family planning, 102 received services, and also 30 caregivers were trained during that time. So still my project is still continuing. What I intend to do in future is to leverage leadership at community level to empower young girls and women to end early pregnancies. Of course, this is the goal of all the services that we do for empowering for young girls and women to end teenage pregnancies in Nairobi, in Kenya, and generally in our society as a whole. The leadership impact that implementing this project has given me from a personal perspective is that I was able to advocate for behavior change, and part of this advocacy really included the recipients to view contraception and family planning as a tool to empower young girls and women to pursue their dreams and desires, to also advocate for sustainability by engaging community leadership to continue advocacy. I was lucky enough just last week to engage with a couple of religious leaders in regards to this. And also, hopefully, I will continue to empower young people and caregivers to take charge as we go forward. Thank you very much for your time.